Osso-D Tablet is a powerful bone health supplement that combines Ossein mineral complex, OMC, and cholecalciferol, vitamin D3. The formulation includes Ossein mineral complex, 830 milligrams, which provides both organic elements like collagen and growth factors, and inorganic elements like calcium and phosphorus, all essential for healthy bone regeneration and strength. Additionally, cholecalciferol, vitamin D3, 400 IU, is included to ensure optimal calcium absorption, which supports bone health and reduces the risk of bone-related disorders. Osso-D is manufactured and marketed by Amgen Vaccines and Pharmaceuticals Private Limited, and its main purpose is to support bone regeneration, optimize calcium metabolism, and enhance bone strength. It is particularly beneficial for individuals suffering from osteoporosis, osteopenia, pregnancy-related calcium deficiencies, fracture recovery, and malnutrition. The product's slogan is, "Boost your bone health with Osso-D." Studies and references of Osso-D Tablet bone remodeling in pregnancy, Arch Gynecol Obstet 2003. During pregnancy, bone turnover is high, with resorption, bone breakdown, outpacing formation, especially in the first 2 trimesters. This uncoupling leaves mothers vulnerable to bone density loss. Relevance to Osso-D, Ossein mineral complex, OMC, and cholecalciferol in Osso-D support maternal bone health by replenishing calcium stores and aiding proper bone metabolism during pregnancy. Calcium Supplementation and Maternal Outcomes, the Journal of Obstetrics and Gynecology of India, 2017. Calcium supplementation during pregnancy helps prevent complications like preeclampsia and preterm births, while supporting both maternal and infant bone health. Relevance to Osso-D. The combination of calcium in OMC and vitamin D3 helps optimize calcium absorption and utilization, promoting maternal bone health and reducing pregnancy complications related to calcium deficiency. Calcium, phosphorus, magnesium, and vitamin D in bone health, maternal and child nutrition, 2016. Adequate calcium, phosphorus, and magnesium in a 2:1 ratio are necessary for proper bone formation and maintenance. Vitamin D aids calcium absorption and bone mineralization. Relevance to Osso-D. Osso-D offers a calcium-rich Ossein complex and vitamin D3 to ensure effective absorption and integration of calcium into bones, promoting bone health during pregnancy. Ossein mineral complex, Crit Rev, Food Sci Nutr, 2006. OMC helps alleviate pain and accelerates fracture healing in patients with osteopenia and osteoporosis. It contains collagen and organic components that support bone regeneration. Relevance to Osso-D. OMC and Osso-D not only provides calcium, but also includes collagen and growth factors that aid bone repair and structural integrity, making it effective for bone loss conditions. Calcium and vitamin D for fracture risk reduction, Osteoporosis International, 2016. The combination of calcium and vitamin D supplementation reduces the risk of fractures by 15% overall and 30% for hip fractures. Relevance to Osso-D. By providing calcium and vitamin D, Osso-D reduces the risk of fractures in populations prone to osteoporosis and osteopenia, including postmenopausal women and the elderly. Ossein mineral complex versus calcium carbonate, Climacteric 2015. OMC is more effective in preventing bone loss than calcium carbonate because it contains both inorganic and organic components that better support bone regeneration. Relevance to Osso-D. The OMC in Osso-D offers a holistic approach to bone health by integrating collagen and protein components, making it more effective than pure calcium salts in promoting bone regeneration. Indications for Osso-D Tablet. Osteoporosis. Weakened bones prone to fractures. Osso-D improves bone density and reduces fracture risk. Osteopenia. Low bone density before osteoporosis. Osso-D helps maintain and restore bone health. Pregnancy-related calcium deficiencies. High calcium demand during pregnancy. Osso-D replenishes calcium stores and supports fetal bone development. Lactation-related bone loss. Bone depletion during breastfeeding. Osso-D helps replenish calcium and maintain maternal bone health. Post-menopausal osteoporosis. Bone health support after menopause. Osso-D helps reduce the risk of fractures. Fracture recovery. Accelerates bone healing and consolidation after fractures due to its regenerative properties. Anorexia-induced bone weakness. Strengthens bones affected by poor nutrition. Burn recovery. Aids bone regeneration during recovery from severe burns. Malnutrition-induced bone loss. Replenishes lost nutrients to restore bone strength and mass. Senile osteoporosis. Bone density restoration in the elderly. Reduces hip and spine fracture risk. Mode of action of Osso-D Tablet. Ossein Mineral Complex, OMC. Contains both inorganic, calcium, phosphorus, and organic, collagen, growth factors, components that mirror the natural composition of bones. Collagen stimulates bone matrix formation and increases flexibility, helping maintain bone structure and preventing brittleness. Growth factors promote osteoblast activity, leading to better bone formation and regeneration. Calcium and phosphorus in a 2:1 ratio, critical for proper bone mineralization and maintaining bone structural integrity. Cholecalciferol, vitamin D3, enhances calcium absorption from the intestines and supports its integration into bone. Helps regulate calcium levels in the blood, reducing the risk of bone resorption, breakdown. Synergistic action. OMC's organic components repair bone microdamage and stimulate osteoblast activity. Vitamin D3 ensures efficient calcium metabolism, maximizing bone density and preventing bone degradation. Contraindications for Osso-D Tablet. Hypersensitivity to any of the ingredients. Individuals with a known allergy to Ossein mineral complex, vitamin D3, or any other component of Osso-D should avoid its use. Hypercalcemia, elevated calcium levels in the blood. Osso-D can worsen the condition. Hyperphosphatemia, elevated phosphorus levels in the blood. Osso-D can further elevate phosphorus levels. Severe renal impairment. Patients with severe kidney dysfunction should avoid taking Osso-D, as they may struggle to excrete the excess calcium and phosphorus. Calcium or vitamin D toxicity. If a patient is already overdosing on calcium or vitamin D from other sources, the use of Osso-D can lead to complications like kidney stones or other mineral imbalances. Drug interactions with Osso-D Tablet. Thiazide diuretics, for example, hydrochlorothiazide, may increase calcium levels in the blood, potentially leading to hypercalcemia when combined with Osso-D. Recommendation: monitor calcium levels closely if used together. Corticosteroids, for example, prednisone. Long-term use can interfere with calcium absorption and lead to bone loss. It may reduce the effectiveness of Osso-D in improving bone density. Recommendation: adjust the dosage or consider alternative therapies if corticosteroids are required. Antacids, containing aluminum, may reduce the absorption of calcium from Osso-D, potentially decreasing its effectiveness. Recommendation: take antacids and Osso-D at least 2 hours apart. Phenytoin. This anticonvulsant can reduce vitamin D levels in the body, interfering with calcium absorption and the overall effectiveness of Osso-D. Recommendation: monitor vitamin D levels and adjust dosage as needed. Bisphosphonates, for example, alendronate, may interact with calcium supplements, decreasing absorption. Recommendation: take Osso-D at least 2 hours apart from bisphosphonates to ensure proper absorption. Magnesium-containing medications. Combined use of magnesium with calcium may interfere with the body's ability to process both minerals effectively. Recommendation: use cautiously and separate the intake by at least 2 hours. Anticoagulants, for example, warfarin. Vitamin D may affect calcium metabolism and interfere with blood clotting mechanisms. Recommendation: regular monitoring of blood clotting parameters is advised when using both. Food interactions with Osso-D Tablet. Foods high in oxalates, for example, spinach, rhubarb, beet greens. Oxalates combine with calcium, reducing calcium absorption. Recommendation: limit consumption of high oxalate foods around the time of taking Osso-D. High phytate foods, for example, whole grains, legumes, seeds. Phytates may reduce calcium absorption by binding to the mineral. Recommendation: avoid consuming large amounts of high phytate foods around the time of taking Osso-D. High fiber diets, high fiber foods may decrease calcium absorption. Recommendation: space out the consumption of high fiber foods and Osso-D by a few hours. Excessive alcohol. Chronic alcohol consumption may impair calcium absorption and bone health. Recommendation: limit alcohol intake to improve the effectiveness of Osso-D. High sodium foods. Sodium can increase calcium excretion in urine, potentially reducing calcium levels. Recommendation: Limit sodium intake to maximize the benefit of Osso-D. Intake instructions for Osso-D Tablet with food or empty stomach. With food. Taking Osso-D with food can help enhance absorption, particularly of vitamin D3, which is fat-soluble. Empty stomach. If taken on an empty stomach, Osso-D may still be effective, but the absorption of fat-soluble vitamin D3 may be reduced. Before or after meals. After meals. It is generally recommended to take Osso-D after meals to improve absorption and reduce the risk of gastrointestinal discomfort. Before meals. While not the preferred time, Osso-D can still be taken before meals if necessary. However, ensure to take with a full glass of water to avoid stomach irritation. Consistency. Take Osso-D regularly as prescribed to ensure optimal results in supporting bone health and preventing deficiencies. Features and benefits of Osso-D Tablet. Bone health support. Osso-D combines Ossein mineral complex and vitamin D3 to enhance bone regeneration and strength, promoting overall bone health. Dual action formula. The Ossein mineral complex provides both organic and inorganic components, including collagen, calcium, and phosphorus, essential for strong and healthy bones. Absorption. Vitamin D3 ensures optimal calcium absorption, crucial for maintaining bone density and strength. Effective for osteoporosis. Osso-D helps in managing conditions like osteoporosis and osteopenia by improving bone mineral density and preventing bone loss. Fracture recovery. Aid. Supports faster recovery from fractures by aiding in bone regeneration and improving calcium metabolism. Pregnancy-related calcium deficiencies. Provides essential calcium and vitamin D3 to address calcium deficiencies during pregnancy. Supports malnutrition recovery. Helps in managing calcium deficiencies associated with malnutrition, promoting healthier bones. Safe and trusted formula, manufactured by Amgen Vaccines and Pharmaceuticals, ensuring high-quality ingredients and reliable results. Dose of Osso-D Tablet standard dose. Pregnancy and lactation. 1 tablet twice a day. Adolescents, 10 to 19 years. 1 tablet twice a day. Osteopenia, 2 to 4 tablets twice a day. Post-menopausal osteoporosis, 1 tablet twice a day. Marketing and manufacturing. Details of Osso-D Tablet. Brand name, Osso-D Tablet. Manufacturer, marketing company, Amgen Vaccines and Pharmaceuticals. Private limited company. Address, 154 Industrial Triangle, Kahuta Road, Islamabad, Pakistan. Manufactured in by accordance with industry standards for quality and safety. Available formulation potencies, SKUs, and pack sizes of Osso-D Tablet formulation. Tablet potencies, Ossein. Mineral complex, 830 mg. Vitamin D3, cholecalciferol. 400 IU SKUs, available in standard packs for retail distribution. Pack sizes, blister pack, 10x 3 tablets per pack. Total of 30 tablets recommended for 1 month supply.